Welcome to AFX Online Rehab Videos, Ankle Sprain Prevention Program. An ankle sprain is an injury to one or more ligaments around the ankle joint. Ligaments help to stabilize the joint by preventing excessive movement. When an ankle sprain happens, the ligament is stretched too far and is either partially or completely torn. If you have an existing injury of the foot or ankle, you must consult with a qualified healthcare professional before beginning this exercise program. If any sudden pain or discomfort is experienced during the program, stop immediately and consult a qualified healthcare professional. The following are a series of exercises that you can use to strengthen your foot and ankle to help prevent ankle sprains. For a complete, step-by-step training program, please download a copy from afx-online.com. To begin, you should warm up the muscles of your lower legs and feet for a few minutes. Some exercises you can perform include stepping in place, calf stretches, or any similar exercises. The first exercise is foot circles. This exercise will help to improve the overall mobility of your ankle. Now we move on to stretching foot and ankle everters. This exercise is important because it helps to maintain and improve mobility of the lateral or outside part of your ankle. Make sure to flex your toes when you are doing this exercise and relax the muscles of the lower leg and really feel that stretch. Next is eversion strengthening. It is done to strengthen the outside of the ankle and reduce risk of sprains. As you are exercising, it is important to make sure that you move your foot through the full range of motion. Don't be surprised if you have limited range of motion and if it feels a little awkward. That's completely normal. Now we'll move on to stretching foot and ankle inverters. This exercise is important because it helps to maintain and improve mobility of the medial or inside part of your ankle. Make sure to flex your toes when you are doing this exercise and relax the muscles of the lower leg. Next is inversion strengthening. This exercise is done to strengthen the inside of the ankle and reduce the risk of sprains. As you are exercising, it is important to make sure that you move your foot through the full range of motion. Now we move on to plantar flexor and toe flexor stretching. This exercise is designed to maintain and improve mobility of the foot and ankle when you are walking, running, or climbing. Make sure to relax the muscles of your foot when you are doing this exercise and really focus on feeling the stretch. Now you'll move on to plantar flexor and toe flexor strengthening. This exercise increases the strength of the intrinsic muscles of the foot to improve foot posture. Really focus on curling those toes. Now we move on to stretching of the muscles of the front of the shin, called dorsiflexors. This exercise is designed to improve mobility across the front of the ankle. Most people have tight dorsiflexor muscles, which can put these muscles at a higher risk of injury. Make sure to relax the muscles of your lower leg and focus on feeling the stretch. Now that you've stretched the dorsiflexors, you move on to dorsiflexor strengthening. Most people have weak dorsiflexors, which also puts them at a higher risk for injury. Focus on bringing your foot as close to your shin as you can and extend your toes at the end of the movement. As you do the exercise, you should feel the muscles on the front of your shin contract. Now we're going to combine some of the exercises that you just completed. Combination movements are a great training technique for promoting multi-directional strengthening, which is critical in avoiding injuries. First, start with dorsiflexion inversion. First, move your foot toward your shin and then rotate the underside of your foot inward as shown. Slowly move your foot back to the starting position and repeat. Next, move to dorsiflexion eversion. Start by moving your foot toward your shin and then rotate the underside of your foot outward as shown. Slowly move your foot back to the starting position and repeat. Now you move on to exercises in the plantar flexion direction, starting with plantar flexion inversion. Point your toes toward the floor and then rotate the underside of your foot inward as shown. Slowly move your foot back to the starting position and repeat. To finish the combined movements, perform plantar flexion eversion. Once again, point your toes toward the floor and then rotate the underside of your foot outward as shown. Now slowly move your foot back to the starting position and repeat. The final exercises in the general program are proprioception exercises. Proprioception is the awareness of your body in space, providing the ability of the muscles to sense when the joint is off balance. Proprioception training helps improve posture and stability. First, trace the letters of the alphabet using your toes with your eyes open. A, B, C, D, and so on. Next, trace the alphabet with your eyes closed. This is a great exercise for further improving foot and ankle proprioception. In addition to training with the AFX, complementary weight-bearing exercises can be performed on Bosu balance trainer and wobble boards, or you may want to try barefoot training. Once you've been training on the AFX for a few weeks, you may want to try eccentric loading, an advanced training method proven to result in greater strength gain. For more details on eccentric loading, and to get a free copy of the Ankle Sprain Prevention Program, please visit afx-online.com.